Hello everybody, I am Dr. Annie from Abeer Medical Center. I am a specialist gynecologist and today I will be speaking about the condition called Polycystic Ovarian Syndrome. This is a condition that can affect your periods, fertility, hormones and aspects of your appearance. It can also affect your long-term health. Polycystic ovaries means that ovaries are slightly larger than normal ovaries and have twice the number of follicles, which are fluid-filled spaces within the ovary. The symptoms of polycystic ovaries include irregular periods or no periods at all, an increase in facial or body hair, loss of hair on your head, being overweight, experiencing a rapid increase in weight, or having difficulty losing weight. Along with that, you can have oily skin or acne and difficulty in becoming pregnant or reduced fertility. So now, what causes PCOS? Although the cause of polycystic ovaries is not known, it appears that polycystic ovaries may be related to many different factors acting together. These factors include insulin resistance, increased levels of hormones called androgens, and an irregular menstrual cycle. So now, what is insulin resistance? Insulin resistance is a condition in which the body cells do not respond to the effects of insulin. When the body does not respond to insulin, the level of glucose in the blood increases. This may cause more insulin to be produced as the body tries to move the glucose into the cells. And insulin resistance can lead to diabetes later. So now, what can high levels of androgens lead to? When higher than normal levels of androgens are produced, the ovaries is prevented from releasing an egg every month, which is what you call ovulation. High androgen levels also cause the unwanted hair growth and acne seen in many women with polycystic ovaries. So if you have PCOS, what are the health problems that you can have? First is infertility, and with treatment most women with polycystic ovaries are able to get pregnant. Successful ovulation is the first step towards pregnancy. For overweight women, weight loss often accomplishes this goal. So medications can also be used to cause ovulation and attain pregnancy. If your blood glucose does not stay normal, then you can have diabetes. 1 or 2 in every 10 women with PCOS go on to develop diabetes at some point of their life. If this diabetes is untreated, it may cause damage to the organs in the body. So if you have PCOS, your risk is further increased. If your risk in developing diabetes is further increased, if you are over 40 years of age, develop diabetes during a pregnancy, is obese, that is with a body mass index of over 30. Now, if you are diagnosed with diabetes, you will be given advice about your diet and may be prescribed tablets or insulin injections. So the next condition that you may develop later in life is high blood pressure, and the next one would be cancer. If you have fewer than 3 periods per year, and the lining of the womb or the endometrium can get thickened, and this may lead to cancer in the womb in a very small number of patients. There are various ways to protect the lining of the womb using the hormone called progesterone. So your discuss will discuss these options with you later. So what can you do to reduce your long-term life risks in health? Have a healthy lifestyle. The main ways to reduce your overall risk of long-term health problems are to eat a healthy, balanced diet. This should include fruit and vegetables and whole foods such as wholemeal bread, whole grain cereals, brown rice. Then you can add lean meat, fish and chicken to your diet. You should cut down on the amount of sugar, salt and caffeine that you eat and drink. Eat meals regularly, and that is essential, especially breakfast. Take exercise regularly, 30 minutes at least 3 times a week. The benefits of losing weight include a lower risk of insulin resistance, a lower risk of heart problems, a lower risk of cancer of the womb, more regular periods, an increased chance of becoming pregnant, a reduction in acne, and a reduction in excessive hair growth. You should have regular checkups. Once you have a diagnosis of polycystic ovaries, you will be monitored to check for any early signs of health problems. That is, the first will be diabetes. Women with polycystic ovaries over the age of 40 should be offered a blood sugar test once a year to check the signs of diabetes. If your body mass index is over 30 or you have a family history of diabetes, then you may be offered a screening test earlier than that age. Cancer of the womb. If you have not had a period for a long time or are having irregular bleeding, it's advisable to see your doctor. You may be offered a referral for further tests that may include an ultrasound scan of your womb or treatment to make you have a period which is more regular. High blood pressure. Discuss with your doctor how often you should have your blood pressure checked and whether you should have blood tests to check your cholesterol levels, and advice will be forthcoming. Many women with polycystic ovaries successfully manage their symptoms and long-term health risks without medical intervention. They do this by eating a healthy diet, exercising regularly, and maintaining a very healthy lifestyle. Thank you.